Hey everyone, I'm Saral Desai, and I'm an incoming psychiatry resident at Tower Health Drexel University program in Philadelphia. And today we're going to talk about letters of recommendation when it comes to applying for psychiatry residency. So I'll be starting with this real life example of me trying to find an apartment to stay during my residency. And I had no idea that it would be so difficult to find a good apartment because obviously there are all kind of reviews out there. And since currently I'm outside Philadelphia, I had to rely on those reviews when it comes to finding an apartment. And I use different websites like apartment.com and Trulia, and then I also used Google reviews. Soon I realized that it's so hard to find out which review to trust and which to not, because there were reviews with 5-star ratings, but they didn't mention anything about apartment. And then there were reviews with 5-star ratings, and they described the apartment as such a perfect apartment that I it was almost hard to trust. It was that perfect. And then there were so many negative reviews that made me wonder that is it possible for an apartment to be this horrible? Are these genuine reviews, or are these posted by someone who wants to badmouth that apartment for whatever reasons? What ended up helping was that my colleagues who were living in that area provided us a list of apartments, and they vouched for some of the apartments. They told us that, this apartment, I have lived here, it's outstanding, and you won't have any problems. Ultimately, I did a combination of reviews on internet, my personal research of those apartments, and then recommendation from my colleagues, and ultimately I found an apartment. The reason I give you this example is similar kind of process happens when you as a candidate apply to a program. Now, it's true that each program have their own way of screening applicants and deciding whom to invite for interview or whom to rank. Well, we're going to talk about a general process that once again makes the most sense because program directors are human beings. They are taking a risk by taking a candidate. They have to work with that candidate for 4 years, and there's only so much that they can learn about you from your CV and personal statement and in an interview. So letters of recommendation kind of works as an additional source for a program to uh, have faith or trust in your abilities to succeed as a resident. And it gives them more information about how you would perform as a resident. So, one thing that is universal is that because the letters of recommendations are supposed to convey your qualities, your clinical knowledge, and your ability to work as a team, if you get a letter which is very generic, which doesn't convey any useful information at all, then that letter of recommendation is pretty useless. So, the first and foremost, the most important aspect of letters of recommendation is that you should try to get a letter from a letter writer who is experienced in writing letters. and who can write a strong letter for you, who can describe your qualities that are relevant to your application, and that reflects that how you would be as a resident. So that would be the first thing. Now, the source of your letter of recommendation also matters, because let's say that you get a letter from a faculty who is part of psychiatry residency. Now, this faculty has years of experience in evaluating medical students, residents, and they have more experience in knowing what it takes to be a good resident. So if this faculty writes you a strong letter, which is not generic, then it gives more reassurance to program directors. It's more trustworthy. It's a little bit easier for program directors to trust. Now, if you get your letter from a physician in private practice, outpatient setting, and that individual writes you a strong letter, once again, this physician has undergone their training from a residency based in US. So they, in a way, know what it takes to be a successful resident, but they may not have a lot of experience in evaluating residents and medical students, because that happens very less often in private practice settings. So when this physician is evaluating you, it is still good, but again, it as a source is a little bit less trustworthy than getting a letter of recommendation from a faculty who's part of residency program. Now, let's say if you get your letter of recommendation from a physician who's practicing outside the United States, then a couple of things becomes an issue, is that you're getting your letter from a physician who may not have enough knowledge and experience about how the U.S. healthcare system works, how the U.S. residency program works. And if that individual is evaluating you, yeah, they can comment about your personal attributes and characteristics and your clinical knowledge. But once again, their letter doesn't provide that much reassurance to program how you would be as a resident in a US based program. Once again, I would like to stress that these are general ideas about letters of recommendation. Each program have their own selection criteria and which type of letter that they weigh in more. But once again, I'm trying to explain this in the most logical way as possible. So this would be the kind of tiers that you may see in letters of recommendation. The first being getting a letter from a faculty who's part of residency program, then getting a letter from a private physician in outpatient setting. The third is getting a letter from a private physician who's not practicing in US. Now let's talk about how many letters should you get from a psychiatrist. The answer would be as many as possible, because when you're applying for psychiatry residency, if you have 4 psychiatrists vouching for you, then that's obviously going to carry more weight than someone from different specialty vouching for you. Once again, it's everything. There are a lot of factors which are combined when the ultimate assessment is made Let's say you get generic letter from a faculty who's part of psychiatry residency, that may not carry much weight. In that case, it would be better if you get a letter from an outpatient psychiatrist who has worked with you enough and who can describe your personal attributes and your clinical skills in detail and in non-generic way. So I hope I'm very clear about this. So yes, you should try to get as many letters from psychiatrists as possible. Now, whether your letter should be waived or not, it should be waived, because you're not supposed to get a letter that you yourself read. It is supposed to be an assessment by faculty which is directly conveyed to the program without you knowing, because that's the only way to make sure that whatever your letter writer wanted to convey, that letter writer was able to convey without worrying about, offending you, or, trying to be in that uncomfortable situation. And that is why it's also really important that you should ask your letter writer beforehand if they are comfortable in writing you a strong letter, which is not generic. Because if you don't clarify that, and if you just ask for a letter and they may not hold a very outstanding view of yourself, then they may still write you a letter, but that may be generic, not too strong, and that would not serve the purpose, because you want to get the best possible letters as possible. So I think this should be enough information about letters of recommendations. If you have any questions, please feel free to post it in comment box, and I would be happy to answer. Thank you so much for listening.